Okay.
Good morning, friends. I'm Dr. Ajay Shah, bringing this another great live. I actually have a very special guest who I work every day together. We share office. Actually, we share a lot of patients. So I have very high respect for her, and she's going to be a great guest for all of you to learn. Let me give you a quick page update. We have now 100,000 followers from all over the world. As you have seen, my wife is now doing live healthy cooking demonstrations on our page. So that's been a great addition. We are also on YouTube. We are also on Instagram. So please reach out to all the social medias. And let's welcome our today's guest, Dr. Tiffany Burns. She actually is a family practice physician, and she also practices some obstetrics. She's a great athlete, a great mom, a great coach, and she has a very high interest into lifestyle medicine. So let's welcome Dr. Burns. Welcome, Dr. Burns.
Thank you.
So please tell us, where do you live, and who do you work for?
Yeah, I live in Marshall and I work for Oakland Hospital in Marshall. I am a family practice physician and I do obstetrics. So my practice is largely obstetrics and pediatrics. And I do have older patients that I care for, though. So I care for everyone from birth until death, which is a really unique practice, and I love it. So, but it
Yeah.
keeps me busy, certainly.
Yeah, I think I've seen you in action right in our office, and you're always energetic, you're always fast in your moves, and you always are smiling and always kind. So I think that's what we want from every family practice, every obstetrics person. So let's dive into the 6 pillars of healthy lifestyle. I want to really get your views, your opinions as a family practice physician. So let's start with healthy eating. Now we have standard American diet. I call it a SAD diet. So please give your views on SAD, Standard American Diet, and tell us what kind of healthy eating do you recommend you practice yourself?
Yeah, so the standard American diet is the typical diet of most of my patients. I do recommend actually more of a plant based diet. So the more plants that you can eat, the better, is what I talk with most of my patients about. So trying to really limit meats or and trying to have lean meats if you're gonna eat meat, but having a lot of vegetables and then fruit. That's what I focus on the most. I think one of the biggest problems I find is that parents or families have a lot of added sugar, especially with kids. It's hidden in everything, so it's in most of our breakfast cereals that are easy for parents to have for their kids in the morning. But some of the breakfast cereals can have as much sugar as a candy bar in it. So that's a big thing. Kids really shouldn't have any more than 9 grams of added sugar, and most of our kids are getting substantially higher amounts every single day. So that is a big thing. Also, I talk about juice intake. A lot of parents think that juice is something healthy for their kids, and I talk to them a lot about trying to get juice out of the diet because it's just not healthy for their teeth or their body. It acts just like an added sugar or pop. Um, that's another thing that I try to get out of the diet is pop. If there's any pop consumption, that can be very addicting, just like cigarette smoking. So we try to work on decreasing and then eliminating the pop consumption. Uh, Other things with nutrition, really just trying to plan your meals, because if you don't plan them, then you're probably going to make some choices, some poorer choices. And reaching for the quicker things tends to be more processed. Not always, but I mean, apples are quick. You can take an apple to work and eat that, but most people are reaching for the more processed snacks and foods, which they might think are healthy, like bars. There's a lot of bars that are marketed as healthy, but they're not necessarily healthy options.
No, I think those are excellent points, and I think we don't realize that cereals have so much more sugar, and we always do. Even I remember for first 15 years in this country, cereal was like every morning I ate cereals with our kids. I mean, even as a cardiologist, so I agree with you. I mean, the way it's been marketed, the way you see the American Heart Association symbols and everything else. I mean, you almost get brainwashed, and I think that's where we need people like you. So I think cereals, sugar, Juice is another thing. I mean, orange juice has been touted as one of the healthy things, but actually it packs as much sugar as Coke. So I think, and then pop, like you said. And then I think your point about planning for the meals is very important because when we are in hurry, when we don't have access to homemade, home cooked food, we immediately, typically, like you said, we typically reach out for a candy bar or a cookie or something which is processed. We typically don't reach out for apple or a banana. I think I agree with you. So that brings to the next pillar. How much you value the physical activity on hour to hour base, and how can people get more active even if they have small disability?
Yeah, that's a great one. So, physical activity or some type of movement every single day is so important. And I really have to work with my patients because some patients, in what they're doing currently in their life, just doesn't give them much room to as active as they want to be. So, really have to work with where that patient is at. Some patients I could just ask, do you have just 10 minutes? Most people have 10 minutes in their day where they can do something. And I just want 10 minutes where you can really get your heart rate up and and move around and be active. If that's all they can give, great. It would be more ideal to have, at least a half an hour to an hour of activity every day where you're really getting your heart rate up. Uh, and I think routine is really important because if you don't make time for it, it's not going to happen. But even if you don't have a specific time, you can make modifications in your day. So let's say you are going into work, park farther away, walk. Don't use the elevator, walk up the stairs. Um, you can try to take mini breaks. Mini breaks are great for your brain if you can take them and walk. Um, Everybody's career is a little bit different. Everybody's, work uh, is a little bit different. If for me, being in the clinic, it's can be a little hard to. I can't necessarily take a break in clinic. I'm walking around and I'll stand and stuff, and I'm sometimes running up to labor and delivery, but it's just like other people's work. They may not be able to get away from their desk for an extended period of time, but certainly if you can, those are some modifications you can do. It just really depends on where people are at and what situation they're in as far as how I recommend increasing their physical activity. But everybody needs it. It's great for stress reduction, and really, really important, especially for women, to get that for their bone health. We talk a lot with my female patients about doing weight bearing exercises and lifting weights actually. So it really, I could go into it for hours
Right.
depending on a person's situation, but it's absolutely important.
No, I think that's an important point you made that just move 20, 30 minutes a day because the recommendation is 150 minutes per week. So that's only about 20, 25 minutes a day. And you can definitely find 25 minutes for yourself. I mean, you go out with a walk with your spouse, go out to play with your kids. I mean, like you said, move at work if your work allows you. I think moving every hour is very important. And we don't have to go to gym and, run on the treadmill every day or a few times a week. We can just vacuum our house. We can take stairs, like you said. And I think we can even, wash our window. I mean, we can do so many gardening, mowing the yard, shoveling the snow. I mean, just be physically active every day. And like you said, physical activity is so much important for our bone health, particularly for women. So I think it's in like weight bearing exercise is must for women to prevent the osteoporosis. And like you also said, exercise and getting your heart rate up gives you that good feel hormones and endorphins and dopamine and everything else. It improves your sleep. So I think the all six pillars we're going to talk are going to work together. So exercise is very important. And that brings our next pillar, and that's a sleep. Sleep, I think, many times is ignored by many people, particularly in the westernized world. They think that sleep is actually the best of time. People who are successful don't sleep, but that's actually a myth, and that's actually a wrong statement. People who are successful make sleep as number one priority. So please tell us your view on sleep.
Yeah, I agree. So for my patients, I really recommend for my adult patients 8 hours of sleep. Most patients need 8 hours of sleep. Um, and really protecting your sleep. So, planning your sleep. When are you going to go to bed? What's your bedtime routine going to look like? I don't want uh, my patients to have any screen time an hour before bed. because it impacts your hormones and it impacts your sleep negatively. And especially for my kids, uh, for my for my patients who are in the pediatric patients, they really need more sleep than we do. And I find that a lot of adolescents aren't getting enough sleep, especially during the school year, because school starts so early and then they're in sports so late, and they're really getting a lack of sleep. So, and then they're watching TV before bed or playing video games. So we need to cut out that screen time, any kind of screen time, looking at your phone. Get your phone out of your bedroom, put it in the kitchen or put it outside of your bedroom. Don't take your laptop to bed. Don't work before bed. And the hardest is probably don't watch shows right before bed. It's a difficult one, but you really need to protect that sleep time so that when you wake up, you feel energized and you're able to accomplish more.
No, I think those are excellent points. I think avoiding screen time hour or two before, not having those Netflix binge, and like you said, having a plan. When you go to sleep, when you wake up, and in sleep science, it clearly says that consistent sleep hours are very important. If you break those consistency once or twice a month, understand, but you cannot stay up all week and think that you will catch up on the weekend. That just doesn't work. It's just not physiologic, and it typically never works. So that brings our next pillar, and that's about stress management. Obviously, stress has gone high over the last 6 months with COVID-19. A lot of people, unfortunately, have lost job or they're working less hours. There are a lot of illness going around. A lot of family members are sick. So definitely stress has gone up, but that's not something new. Stress has been going around for 5,000 years. For the last 40, 50, 60 years, we just are not well equipped to manage the stress. So what are your recommendations? How do you manage stress yourself, being busy physician, mom, and wife, and everything else? So, what do you do for yourself? And also, what do you recommend to an average American to cope with the stress?
Yeah, great question. So for myself, I've got a lot going on with work and kids, and I run a sports program and I coach and different things. So Um, for me, most days I'm waking up at 5 a.m. and working out by 5:30 a.m. So exercising really helps me reduce stress, and when I stick to that routine, it also helps me reduce my stress if I have a plan. What can be hard is I'm on call and I deliver babies at all times of the night or go in to see newborns at all times of the night, and sometimes that plan gets off track, but then you just gotta go with it, give yourself a little bit of grace and get back on track, after things calm down. So those are the things that help me. Sometimes too, I'll try to do monthly massages. That hasn't really been a thing during the pandemic. That hasn't happened, but that certainly can help. In the past, I've done some meditation. I would love to get back doing that, and that certainly helps as well. So, meditation, massage, exercise. A lot of people really benefit from counseling, seeing a counselor, and I've had a lot of patients benefit lately from seeing a counselor just because of everything going on. There's so many changes right now, and so many different stressors, and everybody's stressors are a little bit different. But the other thing is, don't be afraid if you feel like things are overwhelming and you're feeling down, out, depressed, you're feeling hopeless. Reach out to your physician. There's medication options too. So if you can't manage your mood with exercise, meditation, seeing a counselor, then you may need medication. And so don't hesitate to reach out to your primary care physician, because there are many options that we have. So
No, I think those are excellent points. Obviously, best way to cope with the stress is with day-to-day healthy lifestyle, including exercise, meditation, sleep, relationship, reading, and other things. And I think I absolutely have one thing in common with you, which is that we both love Robin Sharma, 5 a.m. Club book. And you told me that you have read that book or you're reading it, and you actually not just read it, but you preach it and follow it. And so that's very, very impressive. So that brings to our next pillar, which is substance abuse and alcohol. And I think one of the physicians we had last night made a good point that as an internist, as a family practice, sometimes our hands are tied in terms of how much we can offer in terms of substance abuse and alcohol, because those things require specific counseling, those require specific physicians, including psychologists, psychiatrists. But as an internist, as a family practice, what is our role in substance abuse and alcohol?
Yeah, I talk about it with every patient, and we screen for it with every patient. And uh, basically, coming up with a plan specific for them, seeing if they can get into a counselor, seeing if they can get into uh, a psychiatrist that can help work with them, because I feel like that is the most beneficial if you have a substance abuse problem. Um, Sometimes that's not always possible though, because insurance dictates a lot of that. And so I have some patients that I work with directly, and I do provide medications to help them and just develop a plan. So, for instance, I had a young woman recently who really struggled with alcoholism, and she could not afford to see a counselor. Insurance kind of did, she didn't have insurance to be able to get the help that she really needed. But we made a plan of cutting back and cutting down and developed a quit date with cutting back so that she wasn't going to risk her health, because you can't just stop drinking alcohol abruptly, or you can really have some serious effects to your health that could be irreversible. So it's really actually dangerous to just stop if you're a daily chronic drinker. And so we developed a plan on how to cut down, and then developed a day of when it would be a good idea to quit after she'd cut back. We followed up, and now she has not drank any alcohol in the last over a month now. So, and just frequent follow up with her. So, it is possible to do that with your PCP, but it's, really, I prefer people to have a counselor that they're working with very closely, and a psychiatrist who deals with substance abuse more. They have more tools, but primary care physicians can do it as well. It takes some planning. So
No, I think that's an excellent point. I think as a primary care physician, family practitioner, internal medicine, we still have to be available as like a bridge and as like a guide to bring them wherever they need to go. But at the same time, like you said, some patients unfortunately don't have the proper insurance. Sometimes they don't have even time. Sometimes they don't even have a proper tools to get up to their place. I mean, many of them have like one car in the family, and it's very difficult to make those appointments. Plus, other thing which is kind of very concerning also that psychiatrist appointments are 2 3 months lined up. I think I can see as a cardiologist patients same day or next day, but
right.
psychiatrists are lined up for 2 3 months. I mean, so it's definitely another issue that nobody can wait 2 3 months when they are not feeling well. So I think family practice and internists have taken up that large responsibility on their shoulder, which I very commend actually. So, and that brings to our last pillar, which is relationship. And I always said that all pillars are important, they work together in a concert. But relationship pillar, in my opinion, is one of the most important pillar, because we eat as a family together with spouse. We go out, walk together with kids and spouse. We are in our community. We are at our church. We are at our temple. So relationships are very important. So please tell us the importance of relationship to stay healthy.
Yeah, absolutely. So your family relationships, I would say, are the most important, right? Those people that you live with. So maintaining those relationships, you have to spend time with those people, and you have to be a part of their life. So, if you're working too much and focusing too much on work and not maintaining those relationships at home, it's going to be rough. The other thing I see with patients that come in is that um, that piece with nutrition, rounding back to how everything is connected. If nutrition is off for mom and dad, or dad is bringing a lot of unhealthy things into the home, or parents are bringing unhealthy things into the home, it affects the whole family. And so I say that changes in nutrition need to be your family needs to do it. So especially in relation to pediatric obesity, it's a really touchy subject of, it's not the child's fault. It needs to be, most of the time, it needs to be a family intervention, because anything that's brought into the home is really game for the child to eat. And so I put it on trying to make changes as a family is really, really important. Um, then your other relationships are really important. So your community. So who's your community? Who helps you? Um, I live in an amazing community. So I moved from Holt to Marshall, and we love our community here. So a lot of close friends that help out with my kids. I'm busy working a lot. My husband, he's a personal trainer, so he has a little bit more time. And we help out other families, and other families help out our family when we need them. So that's really, really important. Um, I mean, I could go on and on about relationships, but really taking care of your close relationships is important, and thinking about who your core relationships are and how you can spend time with those people and grow those relationships. So,
I think I agree. I think relationships are very important. I think you brought a very excellent point about pediatric obesity and the kids. And I was just giving a small talk yesterday. And as we have learned now that the microbiome, the bacteria in our colon, particularly the bacteria in the colon, are actually all set by age 3. After that, we can, but very hard. We typically don't change our microbiome. And by age 3, it's a parent's responsibility to set that microbiome for the kids, because kids at 3 are not going to know what food to eat. And that's what I think, if parents set a good eating habits, the kids microbiome at age 3 will be set for next 70, 80, 90 years. So I think parents have a relationship includes some responsibility also, not just taking, but I think some giving. And that's what I think I always tell people in relationship, give and take has to happen. You cannot keep take, but you have to give also. And I think it applies to friends and the community and family and kids and spouse. And so, that kind of concludes our 6 pillars. So I really, really appreciate you telling your views as a family practice physician. But I also want to ask you, because diabetes is kind of on a rampant, almost 14%, 12 to 14%, African American almost 15%, Hispanics 15, 16%, Medicare population almost 25%. So very, very high prevalence of diabetes, and even incidence is getting higher and higher. So please tell us, number one, what are the reasons and how a person can prevent diabetes and reverse diabetes?
yeah, so preventing diabetes is all about nutrition and exercise and sleep, all those pillars that we already talked about. You know, really trying to have a very healthy diet is key to trying to prevent diabetes. And so the other thing is you can reverse type 2 diabetes most of the time. So I have a great story of a mutual patient between yourself and myself that had type 2 diabetes, and he had seen you, and he came back to me and he was very upset, and he said, that Dr. Shah, he doesn't know what he's talking about. You can't reverse type 2 diabetes. And I said, well, yes, you can. And so we kind of argued back and forth about it as well, and we left it at that. And lo and behold, about a year later, he had hooked up with a nutritionist, and he had cured his diabetes. He no longer has diabetes. And he's no longer on multiple medications. He was on multiple medications for the diabetes as well. And so for some reason, he just needed a different person to tell him what needed to be done, and it clicked for him. And it's, I never expected that from that patient, but it was a pretty cool story of this patient who was very resistant to hearing from you or from me about how diabetes could be cured. But he heard it from one more person, and that made it click. So,
No,
yes.
I think that's a good point. I think the conversation has to start from somewhere. It starts either with me or with you. It has to be keep repeated, and then the person has to actually have an experience from a friend or a family who has done that. Because many times they assume the doctors actually come from the very top high level, and many times they are much more unrealistic. But when they see their own friend or family member doing it, they have much more faith in what we say. So I think this repeat needs to be kept repeated. I think this message needs to be kept repeated. And to be honest with you, I think if somebody has diabetes, and if they go to orthopedic surgeon about their hip replacement, he or she should say, oh, you can reverse your diabetes. More they hear from all of us, more they will believe, because We've been brainwashed in this country that diabetes is irreversible. You always will need pill. In 15, 20 years, you will need insulin. But that thing is absolutely, absolutely a myth and a wrong thing. So I'm glad we brought that point up. And I think we will continue to push our patients how they can have healthy lifestyle and how they can reverse it. So that brings my next important question. That's very, very important question for all of our listeners. And that's when they go see their primary care physician, how can they get the best out of their visit? Because I think obviously they are spending money, even though insurance covers it, but they're still spending money. They're spending time. They are sometimes bringing their family members to bring them. So they're putting a lot of efforts and resources to come and see a primary care physician. And I want all our listeners, followers, to get the best out of seeing a primary care physician. So tell us how they can prepare before they come, what they should do during the visit, and what they should do after the visit.
Yeah, that's a great question. So, um, talking about your annual visit. So, I mean, we see our doctors for lots of different things, but the annual visit, that yearly checkup, is really that visit to talk about preventative health. And so, preventative health measures that I really go into are nutrition, exercise, and sleep and mental health, taking care of your mental health. Obviously, we also talk about those screening procedures, those mammograms, the pap smears, the colon cancer screening, and those things. But coming in knowing that that visit is really to talk about that preventative health and what you can do to be healthier. If you come in with questions that you already have, and really state what your questions are up front, you might not be able to get all of them answered because we are limited somewhat by time. You know, I really try to have those annual visits scheduled in a way where I can spend a lot of time with my patient. I give those specific visits a little bit more time than, say, an acute visit where you're coming in for, knee pain, or you have an ear infection or something like that. So that annual visit, you really need to come in with some questions and really think about, okay, well, what can I do to be healthier? And thinking about what's your goal, what's your one thing that you want to work on, or what are a few things you want to work on, or maybe you have a serious issue where you're really struggling with depression, and that's really the thing you need to focus on. So sometimes I will really target what a patient needs to kind of pinpoint what we need to work on. Sometimes we have to focus on the depression. We have to get that treated first before we're able to work on other things. So trying to figure out what's that one thing that might change multiple things and make you healthier.
Yeah, I think I agree with you. I think even when they come and see me as a cardiologist, a patient who is prepared not only gets a better care, but I'm also more excited to talk about. And I think doctors are human. When there is less interest from our client, it just as any other relationship. When there's less interest from the other party, you also become less interested. That's what I tell patients that when you come with the questions. I will not leave the room until all questions are answered. Take notes when I'm talking. So at least I know that you are very active in terms of listening. You remember better if you've taken notes. And once you go home, talk to your family what the doctor told you, and talk to who you need to get your ball rolling. And I think so. Pre-visit, during visit, and post-visit, a patient almost has to do as if like they are preparing for an event. Just like for any event, we plan everything. Doctor visit is an event, and I think it could be one of the most important event of the year because it may make you or break you in terms of your health. So make sure you take advantage of doctor's visit in a best possible way. So I agree with you. I think so. That brings my last question to you: is that with current COVID-19 crisis, everybody's scared, everybody's afraid. We still have some issues going on. A vaccine is still not out yet. So please tell us how people in general can protect themselves from getting COVID-19, and also in case if COVID-19 happens, what are the things a person should do in terms of visiting the doctor or if needed coming to the emergency room?
Yeah, that's a great question. So, number one, I would say know your risk factors. So, are you a patient with risk factors? Are you 65 years or older? Or do you have chronic illnesses? So, if you have diabetes, hypertension, hyperlipidemia, if you're obese. Um, there's many others, but you need to know what your risk factors are. If you are in a higher risk category, then you really should be um, really making sure that you wear a mask when you go out. It's when you need to go out. Um, you should be taking more safety measures if you're in that higher risk category. If you're in the lower risk category, you still don't want it. You still can have significant impact from it. So, wearing a mask in public places and distancing in public places, and then being really mindful about the core group of people that you're around. I mean, I think we all need social interaction. Um, I think our kids need to have interactions, and we need to, but we need to be careful about those, especially paying attention to our numbers in our community of COVID 19, because we're all in different areas with different levels of risk. So if the numbers are higher in one area, you may need to uh, take that into consideration and limit your activities, certainly. But I think on the side of um, how can you make yourself healthier to prevent yourself from getting COVID? So if you do have risk factors that you can modify, you need to start modifying them. So if you are overweight, how are you going to try to reduce that? You know, get on an exercise plan, um, plan your nutrition, start making some changes to be healthier. So that's really what I would recommend doing that's what I recommend my patients do. As far as if you do get COVID 19, or you do have symptoms, you become febrile, short of breath, sore throat, diarrhea, those things, then really, talking with your physician about testing, quarantining. Those are big ones. So if you do have COVID 19 or think you have COVID 19, you should quarantine. I am seeing way too many people with potential infections who are still going out into the community, and possibly spreading it. And so that's really concerning to me. When you think if you have symptoms, you really need to stay home and not be around anyone else. Have someone bring you food and drop it off. You're going to have to figure out ways and get creative, but you shouldn't be out in the community at all if you're symptomatic.
No, those are excellent points. I think this is a kind of a wake-up call, this pandemic, that our health is important, not just in terms of some of the chronic disease, but even some of the acute illness, particularly acute viral illness can get you down too. Like you pointed out all the risk factors for dying from COVID-19 and getting sicker from COVID-19. And like you said, very appropriately, that you don't have to think that it will take you a few months, few years to get healthier. Your health can start the day you decide to start that good health. And that means healthy eating. I think people who eat whole food, plant-based with less processed food, less animal food, they have less chance of inflammation, their immunity goes up. If they start exercising, their immunity goes up. If they start sleeping, the resistant power starts going up. So you can actually start those 6 pillars like today. You don't have to wait and think that it will take 1 or 2 years. Plus, if you start today, I hope never, but when the next pandemic comes, you'll be only better prepared. So I think those are great points you made. And in terms of I think if you think you got the COVID-19, best thing is, like you said, see your primary care physician, so see a doctor. If it's really bad, short of breath, come to the emergency room. Don't take any chance. And if you feel that you have a mild symptoms and you got it, make sure you quarantine, because you know that it's your ethical duty not to spread it, because if you spread it now, they will spread it to some people you already know, some of your loved ones too. Particularly it applies that if you have a older age grandparents or parents, and if there are many of those chronic illnesses, definitely avoid visiting them. So I think some common sense, some thinking ahead would be very important. So I think this kind of concludes our live. But I really, really appreciate Dr. Burns. I think, I mean, obviously we learn from you, but at the same time, we appreciate that you stay at the front. I know you worked in the urgent care when COVID-19 was happening. So I think you have done your fair share. I've done my fair share. We all are together as doctors, as healthcare providers, as nurses. We also together as people and patients. I think if we work together, we will overcome this pandemic like many things we have overcome as Americans. So I appreciate you. Thank you. I know you are in moving the house thing right now. So wish you the best with that and see you tomorrow at the office. Thank you.
Wonderful. Thank you. You take care.